Welcome to today's webinar on health insurance appeals. My name is Monica Bryant, and I am a cancer rights attorney, co-founder, and chief operating officer for Triage Cancer. I'm delighted to be talking to you today about appeals. At some point during cancer treatment, you may experience a denial of coverage from an insurance company, whether it's for an imaging scan or a prescription drug, a treatment, a procedure, maybe even a genetic test. This is sometimes referred to as an adverse benefit determination. What's interesting about the world of appeals is that many people assume once they get that denial that their insurance company has made a correct decision. They just accept that denial and then try to find a way to pay for that medical care themselves. But the reason that we're here today is because if an insurance company denies your claim, you may have the right to appeal that decision. Those that decide that they aren't going to take no for an answer and file the appeal, many times they win and they actually get coverage for the care that they need. So today I'm going to talk through the various types of appeals and the various types of insurance coverage and some practical tips that you can follow. But before we get into the nitty-gritty of appeals, we need to start with building blocks. In 2013, researchers from Duke coined the term financial toxicity. And in their research, they looked at the financial burden of a cancer diagnosis and how significant that burden can be, not just in an acute way while someone's in active treatment, but also the long-term impact of a financial burden. And we also know that this isn't just about somebody's bank account because we have data on how that financial burden causes stress and depression and anxiety. So financial toxicity has certainly become the buzz term of the last several years, but it is not a new problem. But there isn't one easy solution to the problem of financial toxicity, and that's because there are multiple contributing factors, and those factors can sort of pile on top of each other. So all or most of the factors need to be addressed effectively in order to avoid financial toxicity. And the primary culprit of financial toxicity is having adequate health insurance and effectively navigating that health insurance. And appeals is certainly part of that puzzle. But one of the problems is that even though health insurance is one of the primary contributing factors to financial toxicity, it's so complicated that most Americans don't understand how health insurance works or how to pick a plan or how to navigate that plan once they get it. So we have multiple research studies and so much data that indicates how few of Americans understand how health insurance works. So how could you possibly expect to have a successful appeal if you don't understand how the policies work? So I'm going to start at the very beginning. In the United States, there are three main places where we get health insurance. The largest number of Americans get their health insurance through an employer. The next largest group gets their health insurance through the government, primarily through Medicare and Medicaid. And then the smallest number of Americans actually go straight to a health insurance company and have health insurance. And regardless of where you fall in this triangle of coverage, there are some terms that you have to understand how they are used. So most health insurance policies have a network of providers that they contract with to provide services at a set rate. If you go to providers within that network, you're going to be charged the contracted amount. However, if you go to a provider outside of the network, your insurance company might not cover the services at all. If they do cover the services, they're not going to cover them at as high of a rate as they would if you were going in network. So this is the very first step in understanding your policy and appeals. One of the about they're often termed exactly the same thing, and our example of that today is allowed amount or contracted amount. So you may or may not have a policy that uses allowed amount or one that uses contracted amount. And I understand that I'm cutting out, and I'm sorry. We're just going to keep plugging along and hopefully it gets better. So when I mentioned that there are sometimes multiple terms for exactly the same thing, that causes a problem in how do you know if somebody's using the term correctly? And here's an example of where people often use terms interchangeably that don't actually mean the same thing. So a surprise bill is when a patient has done their due diligence, they've picked a hospital that is in network, they've picked a surgeon that's in network, and they go in for surgery. Then they get home and they get a surprise bill from the anesthesiologist who treated them because they were on the healthcare team. But that anesthesiologist ended up being out of network. So the surprise here is that somebody's done their due diligence. They think I'm going to an in-network hospital. My healthcare team is in network. And how are they supposed to know that this one person isn't in network? So hence the surprise. There have been a number of states across the years that have passed laws against surprise billing. And we've recently had a federal law passed that will go into effect next year, so that it should eliminate these surprise bills for patients. Now, balance billing is when you choose to go to an out-of-network provider, and that out-of-network provider might pay maybe 50% by your insurance company for their out-of-network rate, but you're still responsible excuse me, but you're still responsible for the other 50%. Now, because you chose and you knew that that person was out of network, you're responsible for the half that the insurance company doesn't pay. So all of this is to say, an in-network provider can't balance bill, but an out-of-network provider can. So let's say, for example, the provider charges you $100 for the service. The allowed amount, what they've contracted with the health insurance company to accept, is $70. Because you've gone to an in-network provider, they cannot charge you the $30 to make up the balance. So surprise billing and balance billing is not exactly the same thing, even though you hear the terms often used interchangeably. And the reason we're stopping to talk about this is because if you receive a surprise bill, that might be an opportunity for you to appeal the decision. Another term that gets thrown around a lot, and I'm going to use it several times today, is prior authorization. There are multiple challenges with prior authorization, but it's where an insurance company requires that you, as the patient, go to them before you receive services and get approval from the insurance company that they're going to cover a particular service. The challenges start with, there are multiple names for this. So it could be prior auth or pre-auth or sometimes advanced approval. So understanding what name is being used by your insurance company is valuable. The other challenge is there's no comprehensive list that's provided to somebody about what services do you need prior authorization for and what services do you not need prior authorization for. So sometimes it feels like a fishing expedition for patients trying to figure out, do they need to get this prior authorization or not? There are certainly some things that are more likely to require prior authorization, like surgeries or hospital admissions, but it really varies plan to plan. The other challenge is there's a lot of confusion about who has the ultimate responsibility for obtaining the prior authorization. Ultimately, the responsibility is the patient's because they are the ones that are in a contract with the insurance company. Some healthcare providers and offices and hospitals will help patients with the prior authorization process, but ultimately it is not their responsibility to make sure it happens. The other challenge is that even if you go through all the trouble and you've gotten the prior authorization, it's not a guarantee of coverage. So we have this system that makes people jump through these hoops, and it isn't even a guarantee that the insurance company is going to cover it. So we talk about all of this not necessarily because we have great answers or great solutions, but this is where we want to point out that A, this is where people fall into trouble, but B, if you receive a denial at the prior authorization level, that is something that can be appealed. And then these are the terms that we think are most important for everybody to understand about their policies with respect to cost. So when we talk about the premium, that is the cost that you pay monthly just to have health insurance. So even if you never actually get medical services during that month, you're still responsible for paying the monthly premium. It's like having car insurance all year, but never getting into an accident. Then there are some costs that you incur when you actually use your care. So the deductible is a fixed dollar amount that varies plan to plan, but it's what you have to pay out of pocket before your health insurance company starts picking up their share of the costs. Their share of the costs is referred to as cost share or co-insurance because you are literally sharing the cost. Cost shares are a percentage and you pay them each time you get care. So for example, if you have an 80-20 plan, once you've met your deductible, you're responsible for 20% of your healthcare costs and your health insurance plan is responsible for 80%. Some plans have another fixed dollar amount called a copayment, and that's something that you're going to pay each time you get care. For example, some policies have a $25 copayment to see the doctor, or a $250 copayment if you go to the emergency room. And then the out-of-pocket maximum, I would argue, is one of the most important things that we all should know about our policies, because in a worst case scenario, it is the most that you're going to pay out of pocket for your medical expenses during the year. Again, this is a fixed dollar amount, so you might have a $1,000 out-of-pocket maximum, you might have a $20,000 out-of-pocket maximum. But the way you reach your out-of-pocket maximum is that you add up everything you've paid towards your deductible, your co-payments, and your co-insurance. Usually when we're talking about out-of-pocket maximums, plans will only apply payments made towards in-network services. So here's another reason why it's valuable to understand what the network is. I will also say that this formula of adding up your deductible payments and your co-payments and your co-insurance is what any marketplace plans have to comply with, but some employer plans might have a different way of coming up with the out-of-pocket maximum. So important to look at your specific plan. Now, I realize that this is all a lot. So here is an example. Meet Dan. Dan has a plan with a $2,000 deductible. It's an 80-20 co-insurance, and it has an $8,000 out-of-pocket maximum. Dan hasn't spent anything out of pocket towards his medical care for the year, but he gets into an accident and now has a $102,000 hospital bill. So what is Dan responsible for paying? Well, the first thing we always pay is that deductible for him of $2,000, which leaves $100,000 left of the bill. His co-insurance is 20%. 20% of $100,000 is $20,000. But because he has that out-of-pocket maximum, he doesn't have to pay that full $20,000. He's already paid $2,000 towards his deductible, so he only needs to pay another $6,000 to reach his $8,000 out-of-pocket maximum. Now, I am not suggesting that $8,000 isn't a lot of money. Of course it is. But when we start to look at the alternatives of what he would have to pay without an out-of-pocket maximum or what he would pay without health insurance, that starts to feel more manageable. If you would like to hear any of what I've talked about up until this point, the terms or this example, it is included in our animated video on health insurance basics. Now, the last two things that are important for people to understand, particularly if they have employer-sponsored health insurance, is when and how the policy was issued. So approximately 60% of Americans get their health insurance through their employer. And some employers will pay for their employees' healthcare coverage completely, while others will require that the employee pay a portion of the monthly premiums. There are two types of group health insurance plans, funded and self-funded, also referred to as insured or self-insured. So again, two names for exactly the same thing. A funded plan is when an employer purchases health insurance policies for its employees from a health insurance company. The employee and the employer each pay a portion of the premium, and that money goes to the health insurance company, and the health insurance company will then cover the medical expenses of the employee. A self-funded plan, on the other hand, is where the employer pays directly for the employee's healthcare costs. Now, the employee may also contribute to that pot of money, but it is the employer that's paying for the healthcare costs directly. Where this gets confusing for consumers is that oftentimes the employer in a self-funded plan will contract with a third-party administrator to manage the self-funded plan. And typically, that third-party administrator is a health insurance company. So here is an example of two different health insurance cards that an employee might have, and they look pretty darn similar. Logos, numbers, phone numbers, dollar figures. The card on the left is for a funded plan, and the card on the right is for a self-funded plan. And the only difference is on the self-funded plan, there is this pretty cryptic statement that says claims processing only and assumes no financial risk for claims. And that's supposed to indicate to the cardholder that they have a self-funded plan. Now, if you don't have a card that has this statement on it, or if you're not entirely sure if you have a funded or self-funded plan, you can certainly call the number for member services on your insurance card. You can also ask whomever at your job deals with employee benefits. So maybe that's an HR department, maybe that's a different company, maybe that's the person you turn your timesheet into. But certainly you should be able to ask and get an answer as to whether or not you have a funded or a self-funded plan. And the reason that it's important to understand this is because the laws and the rules may apply differently to you. Now, in addition to understanding if you have a funded or self-funded plan, you also need to understand if you have a grandfathered plan. And those are plans that were in existence prior to March 23rd of 2010, and they haven't made substantial changes since that date. Now, this isn't about when you got the plan, but rather it's about when your employer gets the plan. So again, if you're not sure, talking to that person at your job that might have the answer is incredibly valuable. Okay, so with the terms and the basics covered, I am just going to quickly go over co-payment and co-insurance one more time. So because there's a question about it. So a co-payment is a fixed dollar figure, and your plan will tell you what that amount is ahead of time. So they might say you have a $20 copayment to go see the doctor, a $10 copayment to pick up prescription drugs, a $500 copayment for a CT scan. It could be anything, but they're going to tell you the exact dollar amount ahead of time. A co-insurance is a percentage. So you could have an 80-20 plan or a 90-10 plan or a 60-40 plan. And it's of the that you're responsible and the insurance company is responsible for. So you're never going to know the exact dollar figure because you don't know exactly how much that payment is going to be. So hopefully that answers the question. All right. So once you've received care, you're probably going to get a ton of correspondence. So just from your insurance company, you could get 3 different pieces of mail. One saying, we've received a claim, and one saying, now we're processing your claim. And then finally, the explanation of benefits, or the EOB. Now, EOBs can look totally different. This is just one example of what an EOB might look like, but a telltale sign is somewhere on it in big black letters. It's going to say, this is not a bill. It is incredibly valuable to look at your EOB. Some common information that you're going to see in your EOB is some information about who the policyholder is, a claim number, and the patient name. And the reason this is so incredibly important is because if you are going through the appeals process, this information should be on every communication that you send. Your EOB is also going to have a summary of how much was billed, how much was approved, and how much you are potentially responsible for. The EOB should also have a date and a list of services. Now, not all EOBs are going to have words on it under type of service. Sometimes you just have that CPT code. Now, CPT codes are something that you could Google to try to figure out what the service was. But if you have questions, you should absolutely contact the provider that submitted this bill. You'll see in box 2 here, this is going to be the amount that was charged by the provider, the allowed amount, and remember the allowed amount is what the provider said with the insurance company, we agree to accept that amount, and then the amount paid by the health plan. Some of these services are going to be covered at different rates depending on how much you've paid towards your deductible. And then this final column is going to be how much you're responsible for. A good EOB might also have some information about how much you've paid towards your deductible and how much you've paid towards either your individual out-of-pocket maximum or your family out-of-pocket maximum. Now, the last piece of information that you might get is going to be from your provider directly. This could be the hospital, the doctor's office, the lab company. And the amount here is theoretically the amount that you're responsible for paying. But I say theoretically because you shouldn't take it at face value. The communications don't always come in this order. Oftentimes, the providers are faster at sending you the bill than the insurance companies are at processing the claims. So the general rule of thumb is to wait to get the EOB from your insurance company before you pay any bills to your providers. Certainly, if you get an EOB and the due date is coming up, you should communicate with your provider as to why you haven't paid the bill yet. Call them up and just let them know, I haven't received my EOB yet. Can you push back the due date, or can you make a note in my file? Most providers are amenable to that. Now, when you get your EOB and your bills, it is critical to review those bills for accuracy. Medical bills may keep coming long after treatment is over, so you have to stay diligent and make sure that they're accurate, and that if you believe a procedure or treatment should have been covered and it wasn't, appeal that decision. So how do you actually appeal? There are multiple steps in the appeals process, and the very first step is you have to figure out what type of plan you have, because the details of the appeals process are going to differ depending on the specifics of the plan. So we're going to go through all of these in order. When we're talking about an individual or a funded group plan, that's going to include plans sold on the health insurance marketplaces through the Affordable Care Act, sometimes known as Obamacare. It's going to include plans where you go straight to an insurance company and you purchase a plan. It's also going to include those employer plans that are funded, where the employer collects the money and then the premiums go to an insurance company and the insurance company provides insurance. So for all of those types of plans, this is the process. You have the right to appeal denials of coverage at 2 different times. So you can appeal a denial before services are even received. So that's if you've asked for prior authorization and been denied. Or you can appeal a denial for services you've already received, sometimes called a post-treatment denial. It is very important with appealing in these plans that you follow the company's rules, because generally there are going to be 2 levels of appeals. This internal appeal, where you're going back to the insurance company and essentially asking them to reconsider their decision. And there's going to then be an external appeal. Now, depending on what type of appeal, a prior authorization or a post-treatment, there's timing involved here. So you have to submit your appeal within 180 days of getting that denial. And then the insurance company has to give you an answer within a certain amount of time. If it's for a pre-authorization, they have to give you an answer within 30 days. If you've already received treatment, then they have to give you an answer within 60 days. But there are some times when you need an answer faster than that. And that's when you have the opportunity for what's called an expedited appeal. So if delaying treatment is going to seriously jeopardize your life or subject you to severe and intolerable pain, you can ask for an expedited appeal. And then the insurance company has to give you an answer within 72 hours. Some insurance companies have more than 1 level of internal appeal, but assuming that you followed the rules and you've done the internal appeals as the insurance company has requested, you then have the opportunity to file an external appeal. And this is sometimes called an independent medical review or an external medical review. And the right to file this external medical review is given to us under a couple of different laws. So the Affordable Care Act provides some rules, state laws provide some rules, and if you have an employer plan, a law called ERISA provides some rules. But ultimately, what's valuable for you to understand is that when you file an external medical review, you are asking an independent entity to look at the facts, so to look at the policy, to look at your medical situation, and make a decision as to whether or not the insurance company should have covered that claim. The decision of this independent entity is binding. So if they come back and say, yes, the insurance company should have covered this, the insurance company is required to provide coverage. Now, there are 2 main steps to filing an external medical review. So the first is that you have to file the review within 4 months of receiving your final internal appeal denial. So the last time the insurance company says, nope, we're not covering it, you have 4 months from that date to file your external appeal. And then you have to get an answer within 45 days of that. However, there is an expedited opportunity with external appeals as well. And for certain situations, when it is urgent, you can actually file the internal appeal at the same time as the external appeal. And the reason for that is it means that within 72 hours of filing both of those, you have an answer. And for situations when time is of the essence, that can be incredibly important. There are three main reasons you can ask for an external appeal. So any denial that involves medical judgment, so where your provider disagrees with the health plan that something is medically necessary or not. The second opportunity is a denial that involves a determination that something was experimental or investigational. That's an opportunity for appeal. Or if your insurance company has canceled your policy claiming that you gave false or incomplete information on your application when you applied. This cancellation is sometimes referred to as a rescission. So if a company rescinds your plan, that is an opportunity for you to avail yourself of the appeals process. So that is the basics of appeals with individual or funded group plans. But what happens if you have a self-funded employer plan? Most self-funded plans, as I mentioned, are governed by that federal law called the Employee Retirement Income Security Act, or ERISA. Now, what's challenging about ERISA is that it preempts state insurance regulations, meaning that employers with self-funded plans aren't required to comply with state insurance laws. So if you have a self-funded plan, essentially what you are doing in the internal appeals process is you're asking your employer to reconsider covering a particular service. Now, remember how I said in self-funded plans, there's often that third-party administrator that's administering the plan. So when you file that internal appeal, you might be mailing it to an address that has an insurance company's name on it, but really they're just acting as the third-party administrator. The ultimate decision maker is the employer, because it's the employer that is paying for those bills. As with all appeals, it is critical to follow the rules that are sent to you when you get your denial. And some rules could be the denials have to be sent in writing or 2 copies or 12-point font, or there could be any sort of rules, and you have to follow those rules in order to have an effective appeal. If you've exhausted whatever internal appeals process your self-funded plan has created, you do have the right to an external review. Under ERISA, self-funded plans have to either follow a set federal external review process, or they can voluntarily comply with a state external review process. So that's again what's valuable about looking at the specific rules, because in your denial notice, they should tell you what process they follow and how to avail yourself of that process. Now, just like with the other types of plans, the decision in an external appeal is binding. That being said, there's one extra piece when you have a self-funded plan. Even if you lose at the external appeals level, you still have the opportunity to sue in federal court. And while that sounds fantastic, and it might be very helpful for some people, there are some pieces here that are helpful to know. And the first piece is, when you sue under ERISA, you are limited in what you're able to recover. And the rule basically is that you're going to recover the benefits due to you under the terms of your plan, which means that if you were denied a $100,000 procedure and you win in court, you're going to recover $100,000 to pay for that procedure. But it costs money to hire a lawyer and file a suit. So you may end up spending more money on an attorney that you're not going to necessarily get back, even if you win, and you could potentially lose. The other challenge here is that, remember, with a self-funded plan, it's the employer making decisions. So you are essentially suing your employer to cover this medical service. So if you're still working there, that can get tricky. There are legal protections against retaliation if an employer do, and something to keep in mind. All the different types of appeals I'm going to talk about, there are specific timing requirements involved with self-funded appeals that I've listed for you here. So we've covered individual and funded group plans. We've covered self-funded group plans. Moving on to the federal health insurance options. So Medicare is the federal health insurance program for individuals who are over the age of 65, or for individuals who are under the age of 65 but have a severe disability and are receiving Social Security disability insurance for 2 or more years. There are times when a Medicare plan might deny covering a service that you've received. If that happens, you have the right to appeal. In the cancer context, the most common reasons for a denial in Medicare are that the care was not medically necessary, or that you aren't eligible, that the care is experimental, or there's a coordination of benefits issue. And this is when you have more than one type of coverage. So maybe you have Medicare and you're on your spouse's employer plan. Or maybe you have TRICARE because of your military service and you're on Medicare. There are very complicated rules about who pays first and who pays second, and all of that is called coordination of benefits. And that's a common reason for somebody getting a denial. The way that you would know if you've gotten a denial with Medicare is every 3 months you are sent a medical summary notice, or an MSN. And that MSN is basically Medicare's version of an EOB. So it's going to tell you what's been billed, what's been covered, and what's potentially been denied. If you receive a denial, you should also get some information about how to appeal that denial. And just like with the other types of appeals, there's both a standard and expedited opportunity. In order to talk effectively about how to appeal in Medicare, I have to first make sure that everybody understands the various Medicare options. So when you are in Medicare, you essentially can drive in one of 2 lanes. The first lane is referred to as Original Medicare. And this is where you receive your hospital insurance through Part A, your medical insurance through Part B, your prescription drug coverage through Part D, and potentially a Medigap plan to pick up some of the out-of-pocket costs associated with Parts A and Parts B. Lane 2 is an alternative to Lane 1 called Medicare Advantage. Now, these Medicare Advantage plans, also known as Part C, are managed care Medicare plans where they bundle all of your Part A and Part B services into a managed care plan that's sold by private insurance companies. These plans could be HMOs or PPOs, and they operate very similarly to what we are used to in an employer plan. 90% of Part C Advantage plans also include prescription drug coverage, but if they do not, you can buy a standalone Part D prescription drug coverage plan. And the reason that I have to make sure people understand these 2 different lanes is because depending on what lane you're driving in, the process for appealing is different. So if you are in lane 1, original Medicare, there are 5 different levels of appeals. And you have to go through each one of these levels in order to get to the next level. There's no jumping over levels here. The timing requirements are different depending on which level you are in. The reasons for appealing in original Medicare are very similar. So something's not medically necessary, or you're not eligible, or something's experimental or investigational. Sorry about that. So let's say you're driving in lane 2, a Medicare Advantage plan. Just like in original Medicare, there are 5 levels of appeal, but they're slightly different, particularly at level 1, because level 1 is where you are going back to the plan itself and asking them to reconsider. Again, there are timing requirements, and the timing requirements are different whether you've received the service or you're asking for a pre-authorization, and whether it's standard or expedited. If you are appealing a denial under Part D, again, there are those 5 levels of appeal. Because Part D plans are also sold by private insurance companies, the very first step is to ask for a reconsideration by the plan itself. Some of the most common reasons people receive a denial and then want to appeal is if a Part D plan says we're not going to cover a certain drug, or whether you've met the requirements to get a particular drug, how much you should pay for a drug. And then there's something called an exception request. And this is when a Part D plan doesn't have a particular drug on its formulary, or the drug is at a very high level in the formulary, so you would have to pay much more for it. You can ask for an exception to that to be treated in a lower level so you could pay less. You'll notice that the timing under Part D appeals is significantly faster than anything else I've talked about today. And the rationale behind that is we're talking about prescription drugs. And usually when a prescription drug is prescribed, it's needed sooner rather than later. So moving on to the second type of government health insurance, Medicaid. Now, Medicaid is a federal health insurance program for individuals with limited incomes and sometimes also limited resource levels. And what's particularly complicated about Medicaid and talking about Medicaid and Medicaid appeals is that even though Medicaid is a federal program, each state runs their own program. So there's lots of variation on the details from state to state. Within Medicaid, there are 2 types of plans, just like in Medicare. So in Medicaid, there's fee-for-service, which is very similar to original Medicare. And what it means is you go to a provider and the state pays providers directly for each covered service that a Medicaid beneficiary receives. Compared with, that's not supposed to say Medicare Advantage, that's supposed to say managed care. Sorry about that typo. Under a managed care plan, the state pays a fee to a health insurance company for each person enrolled. That insurance company then provides insurance for all of the beneficiaries. So this is, again, very similar to the HMO PPO in private insurance, and it's similar to Advantage plans, which is probably where my typo came from. So depending on whether somebody's in Medicaid fee-for-service or Medicaid managed care, the details of the appeals are going to be different. But typically there are 2 reasons that somebody's going to appeal in Medicaid. The first reason is eligibility. So is somebody eligible to receive Medicaid benefits or not? And this usually comes down to income or resource level. And the second reason is, should Medicaid cover a particular service or not? With Medicaid, when somebody receives a service or asks for pre-authorization, they are going to get something called a notice of action. I hope that you're starting to see a trend here in that each program has different names for essentially the same thing, because a notice of action is basically the EOB for Medicaid. So it's the notice that you're going to get that something is or isn't going to be covered, or that you are eligible for the program or not. There's some timing requirements, of course, involved in Medicaid appeals, and those are going to be listed on your notice of action. But certain requests are going to be expedited. And for help with the Medicaid appeals process, many legal aid entities handle government benefit situations and can provide services for free or low cost. So what are the levels of appeals in Medicaid? As I mentioned, it's going to depend on which lane, so to speak, you're in. So fee-for-service Medicaid, the first level of appeal is called an evidentiary hearing. But you'll see that I put that it's voluntary. And what I mean by that is it's voluntary for the states to decide whether or not they want to have this level of appeal or not. Some states go directly to level 2, which is a fair hearing. In Medicaid, in a managed care Medicaid program, there is a first level of appeal of an internal, and that's again where you're just going back to the insurance company and saying, please reconsider. If at level 1 you lose, you then have the opportunity to request what's called a fair hearing. Now, fair hearings are where you go in front of an administrative law judge and you're able to present all of your evidence. The judge is allowed to ask questions. And so this is a legal proceeding. Now, it may not look like what you're used to seeing courtroom dramas on TV, but it could be to your benefit if you need to go to a fair hearing to have legal representation. And so at Triage Cancer, we have a quick guide on finding legal assistance. And we also have on our state resources pages, the legal aid entities for most states. What's tricky about Medicaid appeals is that your benefits might stop entirely unless you file your request for a fair hearing or appeal within 10 days of getting your first notice of action. That is really quick, to be honest. If you wait 11 days, then they can cut off your benefits while you go through this process. So paying attention to your mail and acting quickly is absolutely to your benefit in the Medicaid appeals process. So I'm just going to take a quick second and just peruse quickly some of the questions. Okay, I'm going to wait to answer these to the end. And what I want to do now is switch gears about the specifics of different programs and talk more specifically about some general good practices. So regardless of what type of insurance you have, the very first step in appealing your denial is understanding why we're just going to use insurance company for sake of ease, but recognize that sometimes it's the government, sometimes it's the employer. But why did the insurance company deny the claim? Is it for administrative purposes, like the wrong code or your name wasn't right? Are they saying that what you asked to receive isn't medically necessary? And note that's in quotes because that is a specific legal standard. Maybe they're saying that the services are considered experimental or investigational. And that could mean a couple of different things. So it could mean that the provider prescribed a drug that isn't commonly used for whatever type of cancer you have, but the science is showing really promising effects. That's commonly referred to as off-label drug use. It could be that you've entered a clinical trial and the insurance company is denying you because of that clinical trial participation. Now, there's a whole host of rules around what insurance companies are and aren't supposed to cover with respect to clinical trials, but note that if they're claiming that they're not going to cover it because it's experimental, that there are rules about all of that. Very reason that people in treatment were not eligible if it requested under your health plan. And that comes up either for fertility preservation, it comes up when someone's trying to get reconstructive surgery, it comes up a lot. And so these are some of the most common reasons, but it is imperative that you understand why they are denying the claim so that then you can collect accurate evidence of medical necessity. And this could be a whole host of things. So certainly it could be a letter of support from your healthcare provider. It could be your medical records, any sort of notes that your provider has, any test results that your provider has. If something was off-label and they prescribed it, why did they prescribe it? Certainly they're not going to do that without some sort of evidentiary backing. So are there studies or literature or journal articles that your provider can provide you to include? Adding in a personal narrative, again, not, you don't want it to be epic, but you do want to put a personal spin on why you need a particular service. And then any other medical records that are valuable. Now, when we talk about appeals, it is absolutely critical that you work with your healthcare team when you are appealing a denial. And that's for a couple of reasons. The first is there's evidence that you might need that only your provider can give you. But the other reason is sometimes insurance companies deny certain claims on practice. So your healthcare team might have experience with successful appeals for a particular service. And so letting them know that you received a denial and that you're appealing and asking them for help to do so might make your situation significantly easier. I also want to just talk about some really common denials that we see. So under the Affordable Care Act and certain state laws, there are particular services that are considered preventative. And because they're considered preventative, they have to be covered by the insurance company at 100%. However, all of that comes down to coding. So if the person coding the bill codes it as diagnostic versus preventative, you're likely going to receive a bill. And so if that happens and you think that a service should have been considered preventative, like your annual mammogram, for example, but it's coded as diagnostic and you're charged for it, that is an opportunity to appeal. Another common reason, as I mentioned, was mistakes. And I have to tell you, it seems far-fetched, but we see billing mistakes all the time. The most egregious one I ever saw was someone who was charged for 11 surgeries instead of 1 because the biller accidentally hit the 1 twice when they were inputting the data. So again, this goes back to reviewing those bills for accuracy and contacting your provider and letting them know what's going on and asking them to resubmit the claim. So this is one of the easiest types of appeals. Just resubmit the claim with accurate information. I mentioned coordination of benefits when I was talking specifically about Medicare, but it comes up in all types of coverage. So typically every year, I shouldn't say this, many insurance companies will send you a letter asking you to verify if you have any other types of insurance coverage. And if you don't, you click no. If you do, you let them know. And then the insurance company has to figure out who pays first and who pays second. If you don't complete this form, some insurance companies will just deny all of your claims based on coordination of benefits. So contacting the insurance company, letting them know whether or not you have other insurance is step one. And then in the future, making sure you complete all of those forms moving forward. I mentioned services not being covered. Absolutely call the insurance company and ask for more details about why they think a particular service isn't covered, and ask for your full plan benefits language. This is absolutely easier said than done. You might get some pushback saying, oh, they don't provide that, or they don't have that in a way to give to you. But it is in fact your right to get that full plan benefits language to see if a service is or isn't actually covered. Also go back to your provider because they might be able to code it in a different way that would make it covered. Another common reason for denial is that you've reached your frequency limit or benefit limit. Now, most insurance companies are no longer allowed to impose dollar limits on services, but they can still impose frequency limits on some benefits. For example, you are only eligible for 12 physical therapy sessions per year. Once you hit that 12 and you go to 13, 13 might be denied because you've hit that frequency limit. That is absolutely an opportunity to appeal. It's not guaranteed that you can get additional sessions, but that's where engaging with your healthcare team to prove medical necessity is valuable. Appealing a prior authorization. If you failed to get a prior authorization, you can appeal. It is not guaranteed, but what you might be able to do is ask the insurance company for a retroactive prior authorization or certification. Again, it's not guaranteed, but it's worth a shot. If the insurance company is saying that it took too long for the provider to submit the claim, you can ask the provider to resubmit the claim with proof that they in fact submitted it on time. And finally, the experimental or investigational. This is where you're going to have to prove medical necessity and work with your healthcare team to submit the appeal. Now, I say all of this with the full knowledge that we are asking individuals who may be in the midst of active cancer treatment to take on essentially a battle with their insurance company. And that is not always as easy as it sounds. That being said, we also know that millions of claims are denied each year, and only 0.2% are ever appealed. We also know that when people appeal, somewhere between 40 and 60% of the time, those decisions are decided in favor of the patient. So conservatively, half the time when an insurance company is saying we're not covering a service, they're getting it wrong. But yet only 0.2% of the time people are availing themselves of the appeals process. So when we talk about access to care and financial toxicity, we have to look at what we as consumers can do to make sure that the insurance companies are doing what they're supposed to be doing and covering what they're supposed to cover. And because we think that this is so incredibly important, we have a whole host of resources for you. We have a quick guide to accessing your medical records because that, as I mentioned, is imperative, especially when trying to prove medical necessity. We also have a partnership with an entity called Citizen, which will help certain individuals gather their electronic medical records for free. But practically, when you're going through the appeals process, in addition to understanding the rules the timing requirements, and why your claim was denied, you have to get organized. This is not an effective organizational system. There are many ways to be organized, and it doesn't really matter which way you use as long as you use it. So maybe it's file folders or a 3-ring binder, or everything is scanned and put up on a Google Drive. There are some pre-built planners that you can pay for that might be helpful to you. There are some electronic document storage services that you can pay for. These are just some examples of the ones that are out there. As I said, it doesn't matter. Just pick something that you think that you can use and stick with it. Because as some of you have mentioned in the chat box, these bills can come in sometimes a year after you've stopped your treatment, and remembering what pre-authorizations you've had or not had is incredibly challenging. Some other practical tips around staying organized. Again, these might not fit for everybody, but they could be helpful. Keeping one email file in your email for any medical related issues. So getting test results or medical records sent to you. Anytime you email a provider or a billing department or an insurance company, BCC yourself and put that email in this file so that it's all kept in one place. We know that staying organized is challenging in all of this, especially if you're experiencing chemo brain. But this is my reminder that the Post-it note method of taking notes is not preferred. In fact, we've created a health insurance appeals tracking form that you can download off our website. And it's just one way to try and stay organized as you are talking with insurance companies and providers, because you want to keep track of every phone call and every email, the people's names, summaries of your conversations, and then any follow-up to due dates, or excuse me, to due items and dates that you expect a response. I actually think that in addition to working with your healthcare team, this is a fantastic opportunity to engage your friends and family. So we hear all the time the "let me know if there's anything I can do to help you" statement from friends and family. Well, you know what you can do to help me? You can sit with me while I'm on the phone with my insurance company and take notes so that I can just focus on having the conversation and you can be a second set of ears and take notes for me. It sounds potentially silly, but when you are in crisis, this can be an added resource. These are just some things to keep track of, both for the appeals process, but also if you've incurred non-reimbursed medical expenses, those might be tax deductible. So a couple of final things that I wanted to talk about that we hear come up before I get to questions is the concept of peer review. Many insurance companies will utilize something called peer review during the internal appeals phase. And this is where they will ask a medical professional that they've hired to speak with your healthcare professional. On the one hand, this can be really helpful because then your doctor could say, well, the reason I prescribed that drug was because of these 15 studies that have, great evidence. And then the insurance company doctor could say, okay, that makes sense, approved. The challenge with this peer review process is that many times the doctor that the insurance company hires is not of the same medical specialty as the prescribing physician. So you could have a prescribing physician that is a world-renowned expert in precision medicine and knows everything there is to know, talking with a retired OBGYN who doesn't know anything about cancer treatment and precision medicine. And so at that point, are we really talking about peers? So that's problem number one. Problem number two is that oftentimes this peer review process is presented to patients as if it is the same thing as an external appeal, and it is not. Even if you've had a peer review with your internal appeal, you still have the right to have an external appeal and go to that independent entity to get an answer on whether or not the insurance company should have covered. Okay, so here are some things to keep in mind as you are considering your appeal. And I know some of this is repeat of what I've already said, but it's that important that I feel like it's valuable to say it again. You have to understand the exact reason that your claim was denied, because that's going to inform what evidence you need to gather. Make sure you follow the rule to you to the T. If they ask you to sign and date and submit 2 copies and send it via certified mail, make sure you do all of those things. Paying very close attention to deadlines, and to the extent possible, letting any healthcare team that you are working with know of those deadlines. Generally, when talking with the insurance company, remember the golden rule. I know how frustrating it is to get in a denial, and how frustrating it is to have to go through the appeals process when all you want to do is focus on your health and the other things that you think are important to you. But chances are the person that you are talking to on the phone is not the person who made the decision to deny your claim. And so to the extent that you can, remember to be as nice as possible, and that you catch more flies with honey and all the other sayings, try. Remember to avail yourself of the external appeals opportunity if needed, and that if it's appropriate that you need an urgent appeal, file the expedited appeal. And last but certainly not least, stay persistent. Don't give up. We know that a dismal number of people even appeal in the first place, and that number decreases as we talk about appealing higher up. But if an insurance company should have paid, then they should pay. Okay, so the very last couple of things that I need to talk about is what happens if you have a type of plan that I haven't talked about yet today. There are other types of plans that I will not call insurance because they're not actually insurance, and I've listed them here for you, that because they're not actually insurance, don't have to comply with state or federal rules. And we get calls from people that have these types of plans all the time, and they've received a denial and they're calling us to ask us what they can do. And the unfortunate answer is often not a whole lot. And that's why we also don't typically recommend that people purchase these plans, because there are just fewer rules around them. If you have one of these plans, you could certainly try to contact your state's Department of Insurance for guidance, but that is not a guarantee you're going to get help. You can attempt legal action based on potentially contract law, but again, you may or may not be successful. What you certainly could do is try to find a new type of insurance policy at your next available opportunity. And we have tons of information about how to do that on our website. So I hope by now we've talked enough about how you might be successful in appeals, but the reality is you might still lose. And if you do, what are the options then? If you lose your appeals, contact your providers and negotiate. It is valuable to contact them throughout this process and let them know that you are appealing so that unpaid bills don't get sent to collection agencies, but certainly negotiate if you lose that appeal. And you can ask for a couple of different things: more time, writing off a portion of the bill, a payment plan, a lower lump sum. There Many providers are willing to negotiate with you, but you do have to communicate because they can't read your mind and they don't necessarily know what's going on with you. So with that, I have some late breaking news, literally of 4 hours ago. We released a new module on cancer finances, specifically around appeals. So if you have questions about anything I've talked about today or would like more details, I strongly recommend that you take a look at this module, on cancer finances. And again, the very first question that will be asked is, what type of plan do you have? And based on your choice, you will only have to read the information relevant to you.